I know the General Assembly Democrats just had a press conference recently dealing with Medicaid expansion. What's going on with that?
Well, we have legislation, Leader Fitzhugh and I have legislation to fully implement the Medicaid expansion. Over the last few weeks, what we've heard mostly about is the Hospital Association talking about how important it is to those hospitals, and I fully agree with that, especially in these rural areas. Some counties don't even have a hospital, and so the idea that the hospital in a neighboring county could possibly shut down if this bill doesn't pass is of great concern to me. But there are several other pieces to the argument, and that is the federal money is going to help us pay for this. It's going to fully fund this, at least for 3 years. And then I just think that it's the thing to do. We have over 200,000 Tennesseans who don't have any kind of health insurance, even basic health care coverage where they can go once a year and get that checkup with their doctor. Those are very important things. Where I live in West Tennessee, in the past we've been a leader in issues, healthcare issues like diabetes, obesity, heart disease. These are bad things, and a lot of those things could be caught and treated early if someone could just go see a doctor once or twice a year. So this bill, aside from the issue that the hospitals deal with, is important just so those people can get put into the healthcare system and get that basic kind of healthcare coverage.
I guess given the recent fiscal problems with the federal government and budget problems, would the fact that funding might not be there in the future concern you? Since they are having such problems right now, they've even shut down White House tours and stuff like that.
Well, that's a question we could raise on any federal program that we've ever looked at, and I suppose we'll probably ask that question from here on out. But we don't have any reason to think that they're not going to at least fully fund this for 3 years. I mean, that's why other states have begun to adopt this. Other Republican governors, Republican legislatures are beginning to really take a look at this because they know what it means to their population. And so now what we do after the 3 years, maybe we decide that in 3 years. But here we have a chance to really deliver something very important for our constituents for the next 3 years. So I see that question that you asked. I think it's something we could ask about any question, about any issue that the federal government has for us to deal with. But for right now, since we at least feel reasonably sure about it, let's go forward and do it.